Hello and welcome to my channel, Health and Horsepower. I'm super excited because this Wellness Wednesday, we are going to be talking about vitamin D. So I know that many of you may think, oh, I get vitamin D, I get plenty of it, I go out in the sun. But here's the reality. When it comes to vitamin D levels, the sun needs to be at a specific area, at a specific wavelength in order for your body to absorb and actually make vitamin D. That means that in the tropics, if that's where you live, you only need 10 to 30 minutes of sunlight on skin with no sunscreen about 2 times a week to get enough vitamin D. However, if you live in the Midwest like we do, the only time you may be getting enough vitamin D from sunlight is in the spring and summer for a very short period of time. So it's really important to understand that vitamin D, since you can't absorb it through your skin in the fall and winter months, it's very important that you get it from food sources or from a supplement. Now, when it comes to vitamin D actually helps to absorb calcium in your intestines. It actually helps with your calcium and your phosphorus levels in your bloodstream. It also helps with bone health and bone cell health, so helping your body to repair bones that have been damaged and rebuild them stronger so that we don't have osteoporosis. It's also been associated with muscle health and balance, adrenal support. So if you're having adrenal hormone balance issues, if you're under chronic stress, if you're having issues with energy levels, you may have some vitamin D that could be playing a part into that. Another thing that's really interesting is vitamin D has been associated with cell function, communication, and also differentiation. So if your body is having to repair certain cells or areas of your body, if you don't have enough vitamin D, it may struggle to do that. And another thing it's important for is your immune function. Now, you may have heard, as we've had obviously the pandemic going on, a lot of people have been talking about vitamin D levels and making sure that those are in the proper value. I will tell you this, that when you don't have vitamin D levels in the proper value, and let me tell you, our current values that we have, if you get your vitamin D test done, basically is 30 to 100 is the ideal range with most labs. Now, 30 is just enough vitamin D to prevent rickets and bone density issues, not enough to actually help with healthy function, and enough vitamin D to help support all of your systems. But when you have low vitamin D levels, that's not only been associated with higher risk of death, it's also been associated with low bone mass, increased risk for falls and fractures. It's been associated with immune deficiencies and imbalances. Multiple sclerosis is another one that we can see increased incidence when you have low vitamin D levels. Also, certain cancers, you have a higher risk factor if your vitamin D level is low. Vascular disease as well. So if you have any history, whether it's in your family or with yourself, of vascular disorders or cardio issues, you may have some problems with vitamin D where that could make those conditions worse. Another thing I've seen in my office is a lot of times when I have patients coming in with scoliosis, if their vitamin D level is low, that's going to highly impact not only the bone, but also the muscle attached to it. And it can make it a lot worse to get pain relief from scoliosis when we're doing chiropractic, when we're doing exercises and things like that. So really important to remember that when you look at vitamin D levels, that's going to protect you from cancer. It's going to protect you from obesity issues. It's going to protect you from blood sugar imbalances. So if you have glucose or insulin issues, or if you have a diabetic condition already, vitamin D levels being low can definitely make that worse. Blood levels also have been associated with autoimmune issues. So if you or somebody in your family has rheumatoid arthritis, or if Parkinson's or Alzheimer's are a concern for you, vitamin D levels being low can be a big problem. So typically I recommend getting tested at least once a year, preferably at the end of summer, so that we know where you're at before we get into the fall and winter months. Typically when it comes to the recommended daily amounts, the RDA values, they recommend about 600. However, most of the research shows that in order for you to absorb and get enough, we may need values in the 1500 range just to maintain vitamin D levels through the fall and winter. If you're deficient, we do need to get those levels up pretty quickly. I know that some doctors will recommend doing a heavy dosage of like 50,000 units, like once a week or once a month. I personally think that's way too high, and that's going to put unnecessary stress on your liver. So I typically recommend doing a small dosage of anywhere from 5 to 10,000 on a daily basis. And rechecking in 6 weeks so we can see where your levels are at, where they're, how quickly they've jumped up, or if they're back in normal range. And then we kind of talk about how to maintain that. So if you haven't had your vitamin D level tested, we also offer testing in our office for vitamin D levels. It's $50 if you don't have insurance. If you do have insurance with Blue Cross and United Healthcare, typically we can bill those out. I know a lot of the other insurance companies don't cover that in our office, but out the door, if you wanted to get that testing done to see where your level's at, is $50. And then this month, we are also going to be offering vitamin D. We have a liquid form. So basically, you put 5 drops on your tongue to get 5,000 units, or 10 drops on your tongue to get 10,000 units if you are severely deficient. And we can get those levels back in normal range, usually within 6 to 8 weeks. So definitely a good investment to find out where your levels are at, make sure that your immune system, your bone health, and everything's good before we head into fall and winter. So if you haven't had your vitamin D level tested, get it tested. If it is low or has been low multiple times and you're already doing a vitamin D, we may need to look at digestion. We may need to look to see if you're absorbing that properly, or if we need to look a little bit more holistically on how to support your body through that. So if you have any questions, give our office a call, 309-689-6200, or check out our website, freedompeoria.org, to request an appointment or request a consultation. Even if you don't live in Illinois, you can still request an appointment and get some answers and somebody that wants to work with you and help you get your health pathway navigated. So thanks for tuning in. Wellness Wednesday. If you haven't subscribed yet, make sure you hit that subscribe button down below. Thanks for tuning in to Wellness Wednesday.